Hello, now today I want to talk about the signs and symptoms of throat cancer. This is to give the awareness, because these are the signs and symptoms, that you have been treated with more severely, but they are not going away, So stay tuned to the end so that you can be able to know all these signs and symptoms that I'm going to talk on this video. For those who haven't subscribed to this YouTube channel, kindly remember to subscribe, like, share, and leave a comment. Let's know what you want us to do in the next topic. Now, one of the signs is what we call the persistent sore throat. You have been treated with this each and every time, but it keeps on coming. This may mimic what we call throat cancer. So you need to go for further checkup and investigation. The other thing is coughing up of blood. Each and every time you have a cough, but again you realize that there is streaks of what we call blood. This is a sign that you need to be checked further. Don't ignore. The other thing that you need to know is difficult or just painful during swallowing. You feel like there's a pain you never had this pain before, but again now there's pain that is coming during swallowing, either liquid or solid. This is also another sign and symptom that you need to go for a checkup. The other thing is what we call weight loss. Unexplained weight loss. However, this is during advanced stage. You may experience what we call unexplained weight loss. Weak immunity, you're not eating, there's loss of appetite. This is also another sign that more likely than not, there's something weird with your body. You need a health checkup. The other thing is what we call shortness of breath. You experience what we call shortness of breath. Most of the time, you try to breathe, but there's a cut. You couldn't breathe normally the way you have been doing. This might be something else. It is something that you need to go for a checkup. It's something that you need to go for investigations, examination, so that you can be able to rule out this throat cancer. The other thing is the hoarseness of voice. You realize that your voice is, becoming so hoarse. Like you were speaking well, but again you realize that there is something weird with your voice. This is also another sign that you need to go for a checkup. You couldn't ignore these signs and symptoms. These are the things that you should be aware of, and therefore that's why I'm giving this health awareness about the signs and symptoms of what we call throat cancer. Never ignore anything weird in your body. If you realize that there is something that has not been there, or something becoming persistent, then it's up to you that you need to check yourself. You need to do what we call, you seek medical attention, you do investigation and examination, from a doctor and what we call a health worker who can be able to examine you. The other thing is that you can have what we call the painless lump on your neck. You experience there's a mass, mostly below what we call the mandible here. You just realize that there's what we call a mass, a lump, and you don't know where it comes from. You haven't got trauma, but it's there, it's becoming persistent, it's not going away. Then this is also another sign that there's something weird with your throat. There's something that you need to do. So it's good to go when you realize that there's a mass on your neck. You know, you realize there's a mass or either both sides of the neck, then it's good to check yourself. So this and many more are the signs and symptoms of throat cancer that you need to know. You know, now there are those who are at risk of getting this throat cancer. You know, if you smoke cigarettes, you know, you are more likely to get this throat cancer. You are at risk. Alcoholism, you have a family history of throat cancer, you are more likely also to get this throat cancer. You know, so these are some of the risk factors that you need to check on. You know, if you take hot beverages, hot drinks, more likely that you are at risk of getting this throat cancer. This is the end of this video. If you find it so helpful for you, kindly remember to subscribe, remember to like, remember to comment, and remember to share this information to anyone you think can benefit from this health talk. Thank you very much.